Hello, my name is Juanita. I'm a dietitian and diabetes educator. I'm also owner of Nutrition and Health Works, LLC. I have posted some information about the 9 essential things that a person with diabetes needs to know. I am still talking about number 4, then know what the numbers mean. This session is going to be on the cholesterol. As far as risk, it is good to know what your heart risk is. A person with diabetes is 2 to 4 times more likely to have heart disease. And there are several factors that cause this increased risk. A lot of times when a person has diabetes, they also have other health issues as well. So they might also have high blood pressure. They might also have abnormal cholesterol and triglyceride levels. In some cases, a person might be overweight or obese, might not be physically active, and the blood glucose levels might be too high. Also, if a person smokes, that's another risk factor for heart disease. The risk factors I just listed are what I call modifiable, or they are changeable. Simple changes can impact those factors and ultimately decrease your risk, and that is the good news. So let's talk about the heart. The heart is a muscle that pumps blood to the body. It needs oxygen and food to work. The arteries are key to nourishing the heart. And you see the arteries on the outside of the heart here, and those are nourishing and feeding the heart. The arteries are about the size of a spaghetti noodle. So that should give you a little bit of a perspective as far as how big they are. Basically, high levels of the HDL, cholesterol, and triglycerides can cause plaque buildup in the arteries and make those arteries more stiff, harder for them to flex and move. And so here we have an artery that is very clear, and here we have an artery that has lipid deposits of plaque, and you notice that the opening is not as large. So cholesterol, or lipids, it's a waxy fat-like substance found in our blood. It's made by our liver. It's also found in the food that we eat. Here I'm showing you normal blood flow through an artery. There is absolutely no blockage whatsoever. And here in this artery, there is some blockage, so we have decreased blood flow. So eventually what happens is you have this constricted blood flow. You potentially could have chest pain as a result of the decreased blood flow or chest tightness. Stopped blood flow caused by blockage is what we call a heart attack. And so here the heart vessel is completely blocked off and there's no blood flow going through. So we want to prevent those issues from happening. There are some targets from the American Diabetes Association. And for total cholesterol, the target is less than 200. The high density lipoprotein, and its short abbreviation is HDL. And it is good to have that HDL level in your blood high. This is known as the good kind of cholesterol. And what this type of cholesterol does is it carries away the bad cholesterol, or the LDL, or the low density lipoproteins from the arteries that are right around the heart. And for that reason, we need the HDL levels very high. So we want it to be able to do its job. For men, the target is greater than 40. For women, the target is greater than 50. LDLs, or low density lipoproteins, the target would be to have that less than 100, or if a person does already have heart disease, the target would be less than 70. There's another type of fat that is found in the blood, and it's called triglycerides. And all that is, it's a glycerol molecule here. And there are 3 fatty acids that are attached to that, and that's triglyceride. The target for triglycerides would be less than 150. In a future presentation, as part of the 9 essential things to know, I am going to be talking about things to do, small changes to make to help with your cholesterol levels. So stay tuned for that. But for now, action steps would be ask your doctor for a copy of your lab results so you know what your numbers are. How do you take action with something if you don't know your numbers? You can't. So get a copy of your lab results when you do have that blood work done. Ask your doctor about what your targets are for your cholesterol levels. Step 3 would be ask your doctor about your diabetes medicines, because some of those medicines have been found to be helpful to reduce heart risk. If you're thinking that you need a education session with your dietitian or your diabetes educator about your cholesterol levels, I will include that information in the post. The name of my company is Nutrition and Health Works, LLC. As always, I wish you best health.